Now let's take a look at the spectrum of EMRs. EMRs will target specific user bases from solo office-based practices to large multi-specialty care centers. Therefore, many of the features are directed at managing workflows specifically to these user bases. For example, large commercial EMRs will unbundle services such as clinical documentation, results display. In contrast to office systems, where they'll typically integrate all of these under the same interface. Now let's take a look at a diagram of how clinicians will typically interact with EMRs. So again, we have the 5 basic components: the registration system, the lab system, the pharmacy system, the radiology system, and the billing system. These 5 components will enable the entire medical practice to interact on an efficient basis. Okay? For example, the patients will typically interact with the clerks, right? The clerks will typically interact with the registration system. Based on the registration system, the clerks will be able to give clear, concise information over to the nursing staff, who can interact with the lab system and the pharmacy system. The nursing staff can interact with the physicians based on that information. The physicians will have access to the lab system, the pharmacy system, and the radiology system. Once they enter the data into those 3 systems, being that there are built-in codes, the coding staff will be able to deal more efficiently with the insurance companies. Now, the decision support typically is built around the lab systems function, the pharmacy system function, and the radiology system function. Okay, based on the output of those 3 functions, the decision support will be able to give back order entry and results reporting efficiently to the physicians. Now let's take a look at different types of EMRs. EMRs don't necessarily need to be expensive and complicated, and they don't necessarily require that a computer be used to enter data. They can have hybrid computer paper-based approaches. For example, this is interesting. For example, in the Chica system, papers used to interact with an electronic data repository, where standardized paper forms are printed and then scanned. In other words, standardized forms that the physician can fill out are set up in such a way where when they're scanned, the characters are recognized and the electronic data is generated in a form that the data repository can understand. Let's take a look at a case study. Indiana University. Okay, pediatric clinics developed this system. A data repository was developed using a basic Microsoft SQL server. A clinical guideline system was written in Arden syntax. An optical character recognition system called Cardiff Teleforms, is used to process handwritten numerical data on pre-printed scan forms. The data that is generated from these scans are stored in the database, and dynamic reminders are generated for the physician. And these are printed on the clinic computer. This whole process takes 2 to 3 minutes. Let's take a look at another system. Okay, this is a system that the Indiana University has for an HIV effort in Kenya. A simple Microsoft Access-based database holds all patient records, okay, roughly 3 years worth. Now, it provides forms for data entry, standard term dictionary, medication listings, registration system, and clinical documentation systems. This whole thing was created by one programmer over 2 to 3 weeks. It's highly effective, easy to maintain, and very inexpensive. So you see that there are a lot of different types of EMRs that can be used efficiently for medical practices in a variety of different methods. Now, where does the data come from for EMRs? So the data comes from a lot of different sources. First of all, there will be data from admissions, discharge, and billing departments. There will be data from the anesthesia systems, the cytology systems, the diagnostic imaging management systems, there will be data from the EKG carts, the endoscopy systems, and the ER systems. Other sources of data might be from home care systems, ICU monitoring systems, the IV fluid infusion control systems, the laboratory systems, nurse triage, order entry systems, inpatient and outpatient pharmacy systems, and pulmonary function systems. Other data sources might be radiology systems, risk management systems, registration systems, scheduling and clinic charge systems, transcription systems, unit dose dispensing machines, and ventilator management systems. Thanks so much, guys. If you have any questions, please feel free to raise your hands.